Welcome to episode 31 of Real Health Radio. You can find the show notes and the links talked about in this episode at www.7, so seven health.com/31.
Welcome to Real Health Radio. Health advice that's more than just about how you look. And here's your host, Chris Sandel.
Hey everybody, and welcome to another episode of Real Health Radio. And this is another one where it's just me on my own discussing a particular topic. And today's topic is cholesterol. And the word cholesterol has made its way into public consciousness, and just probably hearing the word for most makes them think about cardiovascular disease, or the word cholesterol has real negative connotations. But I think this is a very narrow understanding of cholesterol. And on today's show, I want to cover it in much more detail so you can understand what cholesterol is, what it does in the body, what HDL and LDL mean, and the reasons why someone can have high cholesterol or low cholesterol. So let's start with what is cholesterol. So cholesterol is a fatty substance known as a lipid that is found in all cells in the body. And it's needed for the structural integrity and the fluidity of the cells. And it's not just important for the health and the functioning of the cells, but has lots of different roles in the body. And this is something I'm going to touch on in a minute. But cholesterol is a substance that is made both in the body as well as coming from the diet directly. So while all cells produce cholesterol, the majority of the extra production takes place in the liver and in the intestines. And it seems that these areas are most sensitive to body levels of cholesterol, and they can then increase or decrease production accordingly. So if someone's intake of dietary cholesterol goes up, the body's production will come down. And if someone's dietary cholesterol intake goes down, the production within the body goes up. And roughly 75% of the cholesterol that you have in your body is produced by the body, and with the remainder coming directly from the diet. So obviously these numbers can then go up and down depending on the amount of dietary cholesterol coming in. So what are the functions of cholesterol? Because cholesterol's had such a bad press over the years, often people don't understand its importance in the body. And it feels like keeping cholesterol as low as possible is the goal, and it's viewed as this harmful substance, which it really isn't. So, as I say, cholesterol is abundant in cells and then produced by cells, and it's really abundant in the cell membranes, and it helps with the process of allowing things to come into and go out of the cell. It also plays a role in cell signaling, so meaning that cells can communicate with one another so they can work together as a network. Cholesterol is important for memory and learning, and it does a lot of this action by impacting on the nervous system and helping with neurons to form synapses. And a lot of this process actually takes place while we sleep, and part of the reason sleep is so beneficial for us. And this is especially in the area of consolidating learning, and why sleep can be so beneficial with helping people to learn or consolidating that learning. And it's due to the fact that cholesterol is produced in higher amounts while we're sleeping, and that a lot of this is then used for the brain and for the nervous system. And cholesterol is incredibly important as part of digestion. It's used to synthesize bile acids, and these bile acids are then used to digest your fats. And these are released from your liver, they're stored in your gallbladder, and when you then eat a meal containing fats, you then release it. And it gets released from the liver or the gallbladder into the duodenum, which is the first part of your small intestine. And then as the food, and particularly the fats, moves through that small intestine, they are being worked on by those bile acids. And so by the third part of the small intestine, called the ileum, their job is done. So they've emulsified those fats, they've broken it down so that you can digest them and absorb them. And then it's at this stage in that third part of your intestine that most of those bile salts are then re-entered into the bloodstream and then are brought back to the liver and then get put back into the gallbladder, so it can then be done over and over again whenever you eat a meal that contains fat that then needs digesting. Cholesterol is also a precursor to vitamin D. So when sunlight hits our skin, some of the cholesterol is then converted into vitamin D, and vitamin D is crucial for calcium absorption and function, so aiding with things like bone health. But even outside of its impact on calcium, vitamin D is important for blood sugar regulation and immune system and mental health and lots of other things. Cholesterol is also a precursor to all your steroid hormones. So this means that it's the raw material that is needed for the production of these different hormones. And the hormones that fall under the bracket of steroid hormones can be broken down into three categories. So the first is known as glucocorticoids, and the word gluco meaning glucose. So these hormones have an impact on your glucose and on your blood sugar regulation. And this is not the only thing that they do. They can still impact on your immune function and memory and arousal and other things, but they have a very big impact on glucose. And hormones that fall into this category are cortisol and cortisone. The second category is known as mineralocorticoids, and these hormones have an effect on the minerals in the body, so impacting on your electrolytes and your fluid balance. And aldosterone is an example of this kind of hormone. And then the third category of steroid hormones is your sex hormones. And this doesn't include all of your sex hormones, but just the ones that are steroid-based sex hormones, which would include the different androgens. So androgens are known as male hormones. So that would be things like testosterone and androstenedione. Then there's the three different types of estrogens and then progesterone. So all of these different hormones are dependent on adequate cholesterol being there for the raw material so that they can be produced. Cholesterol is also important as an antioxidant in the body. So oxidation is a chemical reaction that produces free radicals, which are basically unstable molecules. And these unstable molecules can then cause a chain reaction that leads to lots of damage within the body. And what antioxidants do is they inhibit or they silence these reactions so that the reaction takes place, but it's really minimized. And so you don't get the chain reaction or the spiraling effect that can be caused with free radicals. So what cholesterol is able to do is minimize this through its actions as an antioxidant, but also through the production of cholesterol, it goes through a number of different steps and goes down different pathways for that substance to be created. And as part of those steps, you actually create a number of different other substances, two of which are squalene and CoQ10. And both of these are also important antioxidants. So it's not just the production of cholesterol that's important as an antioxidant, but also the whole pathway that then creates these other substances that act as antioxidants as well. So hopefully you can see through that cholesterol isn't this big bad thing that most people think it is. Yes, it can cause problems, and this is something I'm going to cover. But the notion is that, that it is inherently bad, or that everyone should be given statin drugs, which has been suggested, from my perspective, is really wildly off base. So when someone goes to the doctor to get their cholesterol checked, what comes back apart from just the total cholesterol number is numbers related to HDL or LDL or VLDL. So what do those mean? What do they stand for? So HDL stands for high density lipoprotein. LDL stands for low density lipoprotein. And VLDL stands for very, very low density lipoprotein. And so a lipoprotein is a vehicle used in the body to transport different substances around. So rather than certain substances floating on their own in the blood, the lipoprotein will transport them around the body as needed. So some of the substances that are transported by these lipoproteins are fats, fat-soluble vitamins, so things like vitamin A, vitamin D, vitamin E, vitamin K, substances like CoQ10, as well as cholesterol. So basically, these lipoproteins are a transport system that take different substances to different cells or different areas of the body as they're needed. And HDL's main task is to carry cholesterol from the peripheral tissues, so including the arteries, back to the liver. And here it's then excreted or it's used for other purposes. LDL's main role is to transport cholesterol in the other direction. So carrying it from the liver to then the peripheral tissues, which can also include vessel walls. And as I mentioned earlier, all cells produce their own cholesterol, but if they need more, then this LDL is able to bring it to them and deliver it to them. And the LDL isn't just delivering the extra cholesterol, but it's able to then be delivering those fat-soluble vitamins. It's able to deliver CoQ10 and triglycerides as it's needed in those different areas. So because HDL is bringing cholesterol back to the liver, it's considered good cholesterol, and because LDL is taking cholesterol away from the liver and to other places within the body, it's considered bad cholesterol. So I want to now explain in very basic terms what atherosclerosis is, because it's often made the link between cholesterol and cardiovascular disease. So atherosclerosis is the thickening of artery walls that happen all throughout the body. And so the blood vessels become damaged, and then the immune system comes along and it forms a plaque over these damaged areas. So it's kind of like putting a Band-Aid over it. And over time, these plaques can become filled with living and dead white blood cells, which is your immune system, with cholesterol or triglycerides, with calcium and other crystallized material. And with time, if you add in inflammation and other sources of oxidative stress, these plaques can start to fall apart, causing clots. And this is what ultimately leads to clots in the blood and then a heart attack. Or you can have the situation where the plaques are building up, they're becoming inflamed, and it's then narrowing the arteries and hardening the arteries. And it then makes the blood flowing through this much more difficult. So the body response is to increase blood pressure in an attempt to get more blood through. And depending on which arteries are having their flow minimized will then affect the outcome. So if it's the carotid artery, it's going to have an effect on the head and the neck. If it's the coronary arteries, it's going to have an effect on the heart. If it's the peripheral arteries, you're going to have effect on your legs or your arms. If it's the renal arteries, it's going to affect the kidneys and so on. Now, what we've been told for a long time is that having higher amounts of cholesterol and especially having higher amounts of LDL is what actually leads to these plaques forming, and that lowering cholesterol or lowering LDL removes these risks. So basically, this is where the idea of HDL being good is and then LDL being bad is. And unfortunately, it's just not as simple as this. Because you can have populations with low amounts of cardiovascular disease who have low amounts of cholesterol, and you can have other populations who have low amounts of cardiovascular disease who have high amounts of cholesterol. You can have the same thing with LDL, where you have populations where it's high or low, and you can have populations that have high or low cardiovascular disease, and it doesn't work in a normal, straightforward way. And you can even have populations that have high amounts of atherosclerosis, but then don't go on to have strokes or don't go on to have heart attacks or other cardiovascular diseases. So something like cardiovascular disease is really multifactorial, and just one or two markers can't tell us very much. But despite this, there is something that we do know about LDL that does make it more likely to cause cardiovascular problems. And what this is when it starts to oxidize. So LDL is a molecule that's made up of lots of different substances. As I said, it's something that's used to transport things around the body, but as part of it being that vehicle and transporting around, it's made of different substances. And one of the substances that is part of the membrane of the LDL is polyunsaturated fatty acids or polyunsaturated fats. And polyunsaturated oils or fats are fairly unstable and they're fairly fragile. And under the wrong circumstances, they can become oxidized or damaged. So in this situation, the LDL molecule then becomes damaged and starts falling apart and causing problems. And it's these oxidized LDL that can then lead to some of the damage to the artery walls that can then lead to the plaque formation in the arteries. And then the same conditions that can be leading to that oxidizing of the LDL can also be leading to inflammation and a deterioration of these plaques that then lead to the hardening or the narrowing of the arteries, or the plaques then falling off and then leading to clots. So having higher amounts of LDL or having higher amounts of total cholesterol can make it more likely you're going to have heart cardiovascular disease. But really what determines whether this is actually the case is if these LDL particles are becoming oxidized. And unfortunately at this stage, we don't have any way of testing that rate of LDL oxidation within the body. But if we did, it would be really useful a way of seeing what's going on. And instead, what we try and do is use some guessing based on the total amounts of cholesterol or total amounts of LDL, which unfortunately doesn't tell us much. And this is why you can have populations with very high amounts or very low amounts and have very differing amounts of cardiovascular disease. And there's actually a fantastic three-part interview between Chris Kresser and Chris Masterjohn that covers this topic in much greater detail. And I'm going to link to the three different shows in the show notes. And it looks at the history around cardiovascular disease and cholesterol, much more detail in terms of LDL and LDL receptors, and then looking at what normal cholesterol should be and some of the things to do or not do if it's high. So if you want to go into this stuff in much more detail, then I recommend checking them out. But what I want to do to help you better understand cholesterol's role in the body is to explain some of the reasons that it can be either too high or too low, and how this can be affecting things outside of cardiovascular disease. And I tend to see cholesterol as an indicator that something might be going on. And through further investigating, we can look at working out what this may be. So rather than just trying to take a drug or going on a cholesterol-lowering diet if it's too high, starting to look at what are the different symptoms or other markers in the body for why this may be the case. Because if cholesterol is high or low, your body is really doing it for a reason. It's the main producer of this substance rather than it coming from dietary sources. So it's producing more of it. Let's look at why this is happening. And understanding why it's going on is much more important than just shifting it via medication or doing those kind of things to get it in the right range through force. And as I go through this, I'm going to explain the different conditions and also give some blood markers that are likely to happen if that condition's occurring. So for a lot of people, the blood marker information is going to be pretty irrelevant, or you probably won't have heard of lots of the terms. And if this is the case, just don't worry about it. Focus on the different conditions rather than the specific markers. So let's start with high cholesterol. And the first reason could be, or why it's happening, could link into a thing called biliary stasis. So biliary stasis is where the bile can't be excreted from the liver properly. And this could be due to the thickening of the bile, or it could be due to an obstruction in the liver or outside the liver that's preventing that from happening. So in this situation, you'll typically see an increase in total cholesterol, which could be the only thing that shows up on a blood screening. But you could also see an increase in GGTP and also bilirubin. And if the reason for the biliary stasis is due to an obstruction, there's also likely going to be an increase in alkaline phosphatase and ALT. And these are all markers that should be covered on a pretty standard blood test. Symptoms-wise, this condition is going to lead to things like nausea, headaches over the eyes, bitter taste in the mouth, feeling unwell or distressed by eating greasy or high-fat foods, pain between the shoulder blades, and then light brown or yellow-coloured stools. High cholesterol can also point towards hyperthyroidism, and this for me is one of the most common things. You need adequate amounts of the thyroid hormone T3 to convert cholesterol into your different steroid hormones. And so if this is low, then cholesterol levels can start to build up and it can't be converted properly. So if the thyroid is underperforming, you're more likely to see high levels of cholesterol. You're going to have high levels of TSH, low levels of free T3 and free T4, and possibly higher levels of reverse T3. And there's really lots of different patterns that can be going on with thyroid depending on what the issue is. And equally, you can have something going wrong with the thyroid in terms of function or going wrong with its signaling. But when you run the numbers on a blood test, they all look totally normal. And it's why, unfortunately, this stuff can be quite confusing and blood tests aren't always so conclusive. So sometimes I therefore think it's more important to be looking at the symptoms that are associated with poor thyroid function to see if it's an issue rather than just the numbers. So some of the symptoms are fatigue, weakness, weight gain or increased difficulty losing weight, coarse or dry hair, dry or rough pale skin, puffy face or hands or ankles, hair loss or thinning of the outside third of the eyebrows. You can get red, irritated or dry eyes, cold intolerance or cold body temperature or lack of perspiration, muscle cramps or muscle aches, constipation, depression, irritability, memory loss, abnormal menstrual cycles, and then decreased libido. High cholesterol can also be linked with a number of low amounts of different vitamins or minerals. So, for example, you need both vitamin A and copper to convert cholesterol into pregnenolone, which is the first step in producing all of your steroid hormones. So it's not just T3 that's needed, but copper and vitamin A as part of that step. Certain B vitamins like B3 or B5 also have an impact on cholesterol and LDL. And if they're in lower amounts, it could be causing the increased cholesterol or LDL levels. Depending on the severity of someone's deficiency and which vitamins or minerals are low is going to determine the symptoms. So I can't really comment on this and say that these are across the board symptoms you'll notice with this. The next cause could be due to your immune system with immune issues going on. So while LDL is normally thought about as a bad substance and known as bad cholesterol, it actually helps as part of fighting off an infection and with certain infections. And so with these certain infections, it's therefore going to go up to help with this. So from a blood perspective, you're going to see that increase in the LDL as well as the total cholesterol. You're probably going to see changes to white blood cells as well in terms of the amount, as well as the different types of white blood cells and their amounts. So the neutrophils, lymphocytes, monocytes, basophils, and eosinophils. Sometimes when people are then going for the test for this kind of thing, they'll realize that they've been feeling unwell, and so they expect to possibly see immune type stuff showing up on the blood test. Other times they're really not aware, and when I speak to them, like, no, I don't think I was feeling unwell at the time, or I didn't really notice anything, despite seeing real changes in those immune markers. So the next cause for increased cholesterol is stress. Because cholesterol is a precursor to your different stress hormones like cortisol and cortisone, during times of stress, cholesterol can increase so that there's more of that raw material. So, for example, if you were to take someone's cholesterol the day before a big test or an interview versus taking it outside of that situation, you're likely to get very different results. And so often under times of stress, especially in the early stages, you can see an increase in that cholesterol as the body's trying to make more of it available to deal with that stressor. Stress can also be in the realm of oxidative stress. So stress where there's an increased amount of free radicals being created by the body. And in this instance, the body is likely to have higher amounts of cholesterol because it's an antioxidant, and this is how it's trying to deal with the situation. And also, as I mentioned earlier, one of the byproducts of cholesterol production is the creation of CoQ10 and squalane, which are two other antioxidants the body uses to deal with this oxidative stress. So with oxidative stress, you're likely to see an increase in LDL, but you may see then a decrease in total cholesterol and a decrease in HDL. And there can also be an increase in uric acid, in globulins, in bilirubin and ferritin and platelets, and a decrease in lymphocytes and albumin. And the high cholesterol could also be linking into the early stages of insulin resistance or diabetes or syndrome X. And these are all conditions that are similar in that they relate to a problem in glucose metabolism and in proper energy production at the cell level. So with these conditions, you're likely to see high cholesterol alongside high blood glucose, a high HbA1c, a high triglycerides, and possibly an elevated LDL and a lowered HDL. Some of the symptoms that are associated with insulin resistance or early stages of diabetes or even diabetes would be things like extreme thirst or hunger, feeling hungry even after a meal, frequent or increased urination, feeling tired more than usual, tingling sensation in the hands or the feet, or difficulty concentrating or brain fog. The next issue that can then link into high cholesterol is a fatty liver or liver congestion. And this can be associated with a number of different factors. So it could be due to obesity, it could be due to excessive alcohol consumption or alcoholism. It could be due to prescription drugs, from iron overload, from solvent exposure, or even from rapid weight loss. And the changes to the liver can then impair the liver's detoxification capacity. So symptoms with this could also be associated with diminished detoxification, which can be really common. So the blood result patterns would normally be associated with having higher amounts of cholesterol, high amounts of LDL and triglycerides, as well as decreased amounts of HDL and ALT. And the symptoms of something like fatty liver or liver congestion in the early stages are pretty non-existent. But as it progresses and it gets worse, it can lead to things like pain over the right side, fatigue, unexplained weight loss, and weakness. The next condition that can be associated with increased cholesterol is MS, or multiple sclerosis. And MS is a disease that affects the nervous system, where the insulating cover of the nerve cells in the brain and the spinal cord becomes damaged. And it's an autoimmune disease, meaning that the body's own immune system is the one that is doing the attacking of the myelin sheath, which is that insulating cover over the nerve cells. And with MS, frequently total cholesterol will often be increased with a decrease in alkaline phosphatase, intestinal isozyme. And I don't want to give the impression that these are the only changes, and that if you have high cholesterol, then MS should be the first thing you think of. Like, the diagnosis of MS takes a whole barrage of different tests and for lots of other conditions to be ruled out first. But I just wanted to mention that high cholesterol can be part of the picture, even though there are probably lots more likely reasons for why it's high. And then the final reason I don't want to mention for elevated cholesterol is a condition known as familial hypercholesteremia, which is abbreviated to FH. So FH is a genetic disorder where an individual has a mutation in their genes that are needed for the removal of LDL from the body. And there's actually a couple of different kinds of this condition, but the more common and less severe version of it has an occurrence rate of about 1 in 500 people. So it's not actually that rare. And so on a blood test, this would present with someone having high cholesterol and high LDL, which could be similar to people for other reasons. And further testing would then be wanting to look at something like heart function and then doing some genetic testing to confirm if this is a condition. And in this situation, cholesterol levels don't respond very well to dietary and lifestyle changes. So you have had high cholesterol and high LDL all your life. You then made lots of changes and still nothing seems to work and it's always staying elevated. And in these situations, it would be probably worthwhile checking out and getting further tested to see if FH is the problem. And from a symptoms perspective, often there isn't much to go on apart from the high numbers on the blood tests with FH. You can get deposits of cholesterol under the skin, in the tendons, in the eyelids, in the cornea of the eye, but this is really the only telltale symptom. So that's the list of some of the issues or conditions associated with high cholesterol. So some, like familial hypercholesteremia, are directly related to cardiovascular disease. Others are more indirectly related. So something like hypothyroidism, where there is a definite link, but even though there is this link, the focus is more getting the thyroid and metabolism working properly, more so than thinking about heart health. And then others say, like your immune system activation and this pushing up LDL, this pretty much has very little relationship to cardiovascular health. So I now want to look at the opposite, the other side of this, which is the conditions that are associated with low cholesterol. And I often find that low cholesterol is viewed as this good thing, and I don't always agree with this. And I see the same thing happening a lot with low blood pressure. So clients are going and getting their blood pressure tested at the doctor as part of a screening, and they're coming out and they're really low. They're like 105/60. And they're being congratulated and told that you've got really great blood pressure, it's really low, like good work, keep up doing whatever you're doing. And this isn't something that's worth celebrating. And these low numbers can point towards real issues going on. And I think the same way about low cholesterol. Low amounts of it can still be a problem as well, and it can point towards a number of different conditions. So I want to have a look at them. The first reason that someone can have low cholesterol is to do with stress. And I know that I suggested that stress can lead to high cholesterol, and it can, but it can also lead to the opposite. And in this case, I would expect that it's been happening for a much longer time, there's more chronic stress going on, and that it's taking quite a toll on the person. So in the beginning, the body was producing more and more cholesterol to convert into cortisol and cortisone, and there was this higher amount of the cholesterol to start with. But as time has gone on, and this has happened more and more, the body's just converting more and more of the cholesterol into the stress hormones. And that can then just lower the amount of free cholesterol or the amount available for other things. So in that situation, you're seeing a much lower amount of cholesterol. The next reason for low cholesterol could be due to heavy metal or chemical overload. And this could be things like lead or aluminium or cadmium or other toxic metals. Blood test wise, you're likely to see a decreased amount of cholesterol and HDL, TSH, MCH, MCHC, uric acid and platelets, with an increase in total globulins. And really, to confirm the heavy metals, you're going to want to do some other tests. And this can be done through a hair analysis or toxic elements, looking at toxic element testing through blood or through urine. And depending on the level of toxicity and what substance it is going to depend on the symptoms someone gets. So I can't really say how someone's going to be feeling with this. The next condition associated with low cholesterol is biliary or gallbladder dysfunction. And if there's a problem with the gallbladder, this can then impact on the emulsification and the digestion of fats, and this can potentially lead to decreased levels of cholesterol because you need these fats to then create the cholesterol. If there's liver dysfunction, this could also prevent the production of that extra cholesterol that is then shuttled around the body. So this could lead to lower cholesterol levels as well as lower triglycerides and other lipids and lipoproteins. So in the case of biliary dysfunction, you're likely to see not just a decrease in cholesterol and triglycerides, but also an increase in alkaline phosphatase, GGTP, ALT, and then LDH. And the symptoms that are associated with gallbladder dysfunction can actually be fairly similar to biliary stasis that I talked about during the high cholesterol section. So it could be the blood tests that helps to then differentiate between these two. But the symptoms associated with gallbladder dysfunction are pain in the gallbladder region, fever, nausea or vomiting, gas, disorientation, or low blood pressure. So the next issue that can be associated with low cholesterol is hypothyroidism. So hypothyroidism is when the thyroid is underperforming, and hyperthyroidism is when the thyroid is overperforming. And with hyperthyroidism, you'll have an increased amount of T3. And this increased amount of T3 affects the LDL and the HDL cell receptors, and it increases the breakdown of both the LDL and the HDL. And so this then leads to a decrease in total cholesterol, LDL, HDL, decrease in triglycerides as well, decreased TSH, with then an increase in T4 and T3. And symptoms-wise, some of the things that you're likely to experience with hypothyroidism are fatigue or weakness, hand tremors, mood swings, nervousness or anxiety, rapid heartbeat, heart palpitations or irregular heartbeat, dry skin, trouble sleeping, weight loss, increased frequency of bowel movements, and light periods or skipping periods. The next reason for a low cholesterol reading is too low amount of fat in the diet or general malnourishment. And this could come from someone unintentionally undereating, with fat being just one of the macronutrients that's too low. It could be for something like an eating disorder like anorexia or severe calorie restriction due to famine. It could be someone actively keeping their fat low, or maybe someone doing a vegetarian or a vegan diet where fat just drops down because they've been excluding certain foods that are naturally containing decent amounts of fat. And because fat is one of the substances that's needed to create the cholesterol molecule, if it's too low for too long, then cholesterol production can go down. And in all of these cases, you're likely to see decreased cholesterol, LDL, HDL, and triglycerides. And then the other markers are really going to depend on the driver. So what is going on? So the picture of someone who has anorexia is going to be very different from someone who's eating a vegetarian diet, whose calories are high enough, but their fat's just too low for what they need. The next reason for low cholesterol could be someone with autoimmune process that's going on. And this varies because obviously I mentioned that with MS, which is an autoimmune disease, it can increase the cholesterol. But with other autoimmune processes, it can be having the opposite impact. So in this case, you'd have sort of low to normal cholesterol with low triglycerides and increased HDL. And this kind of pattern would then warrant some further investigation, looking at different inflammatory markers or destructive markers, which would be needed to make that diagnosis. So things like C-reactive protein, ESR, ANA, rheumatoid factor, and other markers like this. Symptoms-wise, it's really hard for me to comment on this one because autoimmune issues are so kind of wide a category, and there can be so many different symptoms depending on the condition. There's going to be some level of inflammation going on, but whether or not this will be registered as pain or skin issues or whatnot will really depend on the situation. And then the final reason for low cholesterol can be digestive dysfunction or malabsorption. And this is pretty similar to my comments about gallbladder dysfunction, because if the gallbladder isn't working well, they may be having trouble emulsifying and digesting fats. But it's not just the gallbladder. It could include things like the pancreas, where it's not working as well as possible and it's not producing the right pancreatic enzymes to help with the digestion of fats. Or it could be coming from liver issues, where it's struggling to produce the bile in the first place. But all of these different issues are meaning that digestive function and malabsorption is a problem. And some of the symptoms that could be part of this are a feeling of nausea on a regular basis, especially with fatty meals. It could be dry and brittle skin or hair, or it could be constipation. So that's it for then the symptoms that can link into low cholesterol. And part of the reason I wanted to do this show is that there seems to be really two schools of thought around cholesterol, both sitting pretty much at opposite ends of the spectrum. So one is that cholesterol is bad and that high amounts lead to cardiovascular disease, and that really we should be doing anything we can to reduce it, and hence sometimes suggesting that everyone should be taking statin medication as a preventative, which is like one argument. And then the other end of the spectrum is that the cholesterol numbers don't mean anything, that you can have high or low amounts and both be suffering with cardiovascular disease or totally free from cardiovascular disease. So really these numbers are useless and people shouldn't be paying attention to them. So for me, I prefer the middle ground where cholesterol numbers aren't useless. And if they're higher or lower, then it can be pointing towards something. But that something isn't always cardiovascular disease, and further investigation or looking at other markers is important to determine what's going on. So rather than trying to forcibly shift the numbers, say through medication, let's work out why they are where they are and what could be the root cause of this that we could then be dealing with. The final thing I just want to mention, which actually makes all of this quite difficult, is that the numbers fluctuate on a fairly regular basis. And these fluctuations can be pretty big jumps up and down, even when there really isn't any major change to the baseline. And this is information, again, that comes from the Chris Kresser and Chris Masterjohn podcast on cholesterol that I talked about earlier on, that I've linked to in the show notes. So let me use cholesterol as an example. In the US, the reference range for cholesterol is somewhere around 130 to 150, up to around 200 to 220. But probably more around the 130 to 200, as there's a tendency towards lower being better. And so this is normally thought of as the range that people want to be in. So Chris Masterjohn talks about the fact that the normal fluctuations for cholesterol can go up and down by about 35 grams per deciliter before you started to move out of your own normal range. So for an example, if you have one test and it shows a reading of 160, and then the next test that you do shows a reading of 190, while the thought is that you've actually increased by 30, this increase could be part of your normal everyday fluctuations, and actually you're sitting in the exact same place as you were for the first test. It just appears higher because of the day you chose to do the test on. And Chris Kresser actually gives his own example of this. He mentions that he tested his cholesterol at 4 different times over the month, and he didn't change anything to do with his diet or his lifestyle over this time. So for all intents and purposes, things should have been the same. But when he tested the first time, it was 185, then it was 220, then it was 193, then it was 205. And these kind of numbers could be the difference between someone being told to take a statin drug at the high end or someone being told that they're in a good range at the low end. And this is all within the exact same month and all without any active dietary or lifestyle changes. So be aware that significant variations can occur with these numbers on a regular basis, and probably don't take any one test result too seriously. If there seems to be a large change, check it again and see if this number still holds true. As much as we like to talk about blood markers as being this gold standard, that certain patterns should point towards this or that, there can be real variations for no other reason than just regular and normal fluctuations within the body. So definitely keep this in mind. So that is it for this week's episode of Real Health Radio. I hope you found it useful and you have a bit of a better understanding of what cholesterol is and what conditions that it can point towards if you're having too high or too low amounts. Really, this is just scratching the surface of this stuff, and there's so much more that I could have covered. I hope you have a good week, and I'll then catch you next week on the show when I'll be chatting with a guest.
Thanks for listening to Real Health Radio. If you are interested in more details, you can find them at the 7 Health website. That's www.7health.com.